So it's something very similar in some part in respect to the presentation of the bike, because I use this device to evaluate, I use the software to evaluate which is the effect of the peripheral scleral lenses fitting on the, and for this I've used some point related to the possibility to evaluate in an objective way. Something very difficult to evaluate just using the slit lamp. So, as you know, fitting scleral lenses is, it seems simple, but it's not simple, because it's important to understand some relationship, and some relationship are not so clear, because if we fit a corneal lenses, we have a topographer who support us to try the best relationship with the lens and the cornea. But using scleral lenses, the most important thing is the relationship between the peripheral part of the lens on the scleral, and to evaluate which is the interaction. For sure, we have different behavior in the scleral. We can use just the topography to understand what's happened in the scleral. This is a very interesting paper published on contact lens research and science, where these researchers found different behavior in the scleral profile. And so it's not possible, it's not like to evaluate a simple astigmatism, because there are different toric behavior, and we have also different behavior in the depth of the anterior segment. And so, in which way I can fit a scleral lens without information on the peripheral part of the eye. So, we have instrument, Brian have the ESP instrument, or it's possible to have more information using some OCT devices, but these instruments are not so introduced in clinical practice and are not very cheap to put inside the practice. And so normally slit lamp is still the instrument more used in clinical practice to evaluate the behavior of scleral part. And in another interesting paper, there was a survey to understand which was the instrument used to evaluate scleral lens fitted. And the results are that 85% of new and 98% of experienced practitioners use slit lamp to evaluate the behavior of the lens on the scleral surface. And so, again, we use a subjective approach to evaluate the relationship between the lens and the anterior segment. And normally, which is the behavior, or which is the measurement we have to do using the slit lamp. So, evaluate the bulbar redness or the vessel compression. And so, this is as the AOS anterior can do in an automatic way. And for this, there are some grading scale too. And this is a grading scale from the Ferry State University. It's useful, but not validated at the moment. I don't know paper published on peer-reviewed literature to understand if it's correct, this approach, or not. And again, using your results, there are some maybe meaning in different behavior and in the not possible interchange between different grading. Because in this interesting paper published on optometry and vision science, different grading scales were used to evaluate the different value from subjective point of view. And as you can see here, the differences between grading scale are higher. The task to do during this research was easy. So the practitioner had to evaluate in a scale from 0 to 100, which was the level of redness for them. And as you can see here, we normally use a grading, but a grading for a special scale, not universal. And so in this case, the level or redness for the last grade is lower in respect to the EFROM scale. And so it's not possible to compare the results as in support on your result too. And for this is important when we have something to measure, have something more objective. And this is the results obtained in different paper on the evaluation of anterior segment using objective software. And this was our idea. So to use AOS anterior to evaluate what's happened when we fit a scleral lenses to obtain more information and to compare with the objective approach on this topic. And the objective approach is the use of OCT device. So in this case we can measure which is the compression and considering the relationship between the redness and the compression, evaluate if these two systems are correlated between them. And so to do this, we use a scleral lenses, an Italian design, and this kind of scleral lenses have the possibility to change the periphery, because our idea is to modify, to introduce something wrong during fitting, to evaluate what's happened, because the normal thing, so it's easy, but not useful for us to understand what's happened. And this was the idea. And we use the same angle about the vault. We consider normal cornea, not irregular cornea, because it was just to understand the peripheral behavior. And we consider a clearance, central clearance of 250 micron, and we modify the periphery to change the relationship between the lens and the scleral. And we evaluate in different four directions the behavior using an OCT. This is an OCT from Optopol with a resolution of 2.6 micron and a scan per second of 110,000 scans per second. And we consider also a problem, because sometimes it seems simple to evaluate the result with the OCT, but it's not simple, because the index of refraction change or introduce optical artifact. And I can consider in this case, okay, I have a compression here, but this is an artifact, it's not real. It's induced by the thickness and the index of refraction of material. So in which way I can evaluate this condition and to consider the results for the final situation. The idea was to fit the lens and very, very fast to measure this one. And so the lens had no time to do some compression. And in this case, I obtain this value, and I remove this value from the value found on the same point after a minimum of 2 hours of lens wear. And in this case, is a simple approach to evaluate which was the compression induced by the lens. And okay, we consider also different position. So this is the peripheral part, and we divided this part in 3 different places, starting from the edge of the lens, to obtain always measurement very, very close with the lamp, slit lamp, and with the OCT. And we did the same thing with the AOS. In this case, we measure, we use the function, the comparative function, and we introduce another small area to evaluate which was the redness, and so the results obtained in these spatial areas. Using this value, we plot the results considering the compression in the three different areas and considering the different behavior in four quadrants. And as we can see here, the scleral is not regular. In normal patient, it's not regular, but in the case of irregular cornea too, because we have not the same compression in the four quadrants. And this is the first condition. And we have support on this result using the AOS software too. And as you can see here, where we have the higher compression, as here and here, we have the lower redness, so the area were more clear. But this was not enough, and we consider also to plot the changes with the bulbar redness with the conjunctival compression. And as you can see here, the result was very interesting, because there is a very high correlation between, inversal correlation, between compression and the redness. This was just with the lens on. Further studies are useful to understand which is the rebound effect. So removing the lens, what's happened on the anterior surface. But this is what just a preliminary approach. And I think using software like AOS anterior is not so easy to fit scleral lenses, but we do this in a more objective way, and we have more reliable results if we change, or we can control, check again our patient. And so, thank you very much for your time.